Hello, dear friends, and welcome back to Levitas, your trusted source for weight loss, health, and wellness insights. In today's video, we're going to dive deep into a topic that is essential for your optimal health: potassium and the unknown low potassium epidemic. This video will help you to learn and understand why potassium is so important, what happens when you have low levels, and how you can make sure you get enough in your diet. So, come on and join us as we get started on this interesting topic. What is potassium and its functions in the human body? Potassium is an essential mineral and electrolyte that plays a crucial role in numerous bodily functions. It's vital for muscle function, nerve transmission, and maintaining a proper balance of fluids and electrolytes. Potassium is also important for regulating heart rhythm and blood pressure, as well as supporting proper kidney function. Why is potassium important for optimal health? Potassium is a key player in maintaining your overall health. It helps regulate your heartbeat, supports muscle function, and aids in fluid balance within cells. It can also help reduce the risk of hypertension, strokes, and heart disease. Maintaining proper potassium levels is essential for your overall well-being. What are the symptoms and signs of low potassium levels? When your body is lacking on potassium, you may experience a lot of different symptoms. These can include fatigue and weakness, muscle cramps or spasms, irregular heartbeat, nausea and vomiting, numbness or tingling in extremities, high blood pressure, constipation. The normal range of potassium levels in the blood for adults is typically between 3.5 to 5.0 millimoles per liter. This range may vary slightly depending on the laboratory and the age of the individual. It's important to maintain potassium levels within this range to avoid potential health issues related to low or high potassium levels. Low potassium, also known as hypokalemia. Blood potassium levels below 3.5 millimole per liter can cause symptoms such as fatigue, muscle cramps, weakness, irregular heartbeat, and constipation. High potassium, also known as hyperkalemia. Blood potassium levels above 5.0 millimole per liter can cause symptoms such as muscle weakness, fatigue, nausea, or more serious issues such as arrhythmias. What happens when you have low potassium levels? When you have low potassium levels, known as hypokalemia, it can lead to a range of health problems. These can include heart issues, an irregular heartbeat, and increased risk of arrhythmias. Muscle weakness. This can affect everyday activities and physical performance. Blood pressure problems. High blood pressure and hypertension may develop. Digestive issues. Constipation is a common symptom of low potassium. What are the recommended doses for potassium intake on a daily basis? The recommended daily intake of potassium varies depending on factors such as age, sex, and individual health needs. However, according to dietary guidelines, the general recommended daily intakes of potassium for adults is around 3,500 to 4,700 milligrams per day. Here's a breakdown of the recommended daily intake of potassium by age group. Adults ages 19 and older years, 3,500 to 4,700 mg per day. Adolescents ages 14 to 18 years, 1,000 to 4,500 mg per day. Pregnant or nursing women, slightly higher requirements because of the increased consumption of nutrients. Children in ages between 9 to 13 years, 2,500 to 3,000 mg per day. Children in ages between 4 to 8 years, 2,300 mg per day. Toddlers in ages between 1 to 3 years, 2,000 mg per day. Infants in ages between 0 to 12 months. Potassium needs for infants are met through breast milk or formula and typically range from 400 to 700 mg per day. It's important to note that individual potassium requirements will vary based on factors such as age, activity level, health conditions, medications, and pregnancy or lactation status. Additionally, those with certain medical conditions, such as kidney disease, may require adjustments to their potassium intake based on their healthcare provider's recommendations. Always consult with your head healthcare provider to determine the specific dose that is best for you. What are the causes of low potassium levels? Several factors can contribute to low potassium levels. Inadequate dietary intake, a poor diet that is low in potassium-rich foods. Loss of potassium through vomiting, diarrhea, or excessive sweating. Certain medications, diuretics and laxatives can lead to potassium loss. Underlying health conditions, kidney disease, adrenal gland disorders, and certain chronic illnesses can affect potassium levels. What foods have the highest concentrations of potassium? You can find potassium in many fruits, vegetables, and other foods, including bananas, a classic potassium-rich fruit but also very high in carbs. Spinach. Leafy greens are excellent sources. Sweet potatoes, rich in potassium and other nutrients. Avocados. Packed with healthy fats and potassium, it is one of the highest potassium-containing foods. Tomatoes. Whether fresh or in sauce form, tomatoes are great sources. Beans. Legumes like black beans and lentils are full of potassium. Nuts, like macadamia nuts, are rich in potassium, amino acids, and also healthy fats. What is the treatment for low blood potassium concentrations? If you're diagnosed with low potassium levels, treatment options can include dietary changes. Increase your intake of potassium-rich foods, such as leafy greens and avocados. Supplements. Potassium supplements may be prescribed in recommended doses and under medical supervision. Adjusting medications. In some cases, adjusting other medications that affect potassium levels may be necessary. These medications that affect potassium levels include some common examples like diuretics or water pills, such as furosemide, hydrochlorothiazide, and spironolactone, can cause potassium loss through increased urine output. AC inhibitors and angiotensin II receptor blockers. These are commonly used to treat high blood pressure and heart failure, may increase potassium levels by reducing the excretion of potassium in urine. Non-steroidal anti-inflammatory drugs, like ibuprofen and naproxen, can cause potassium retention by inhibiting renal prostaglandin synthesis. Potassium-sparing diuretics, such as amiloride and triamterene, can cause high potassium levels by reducing potassium excretion in the kidneys. Immunosuppressants, like tacrolimus and cyclosporine, used to prevent rejection after organ transplantation, can affect potassium levels by various mechanisms. Beta blockers, such as propranolol and metoprolol, may increase potassium levels by reducing the uptake of potassium into cells. Antibiotics, like penicillin G and trimethoprim sulfamethoxazole, can affect potassium levels, usually by increasing potassium concentrations in the blood. Antifungal medications, including amphotericin B, may cause potassium loss by affecting renal function. Always consult with a healthcare professional before making significant changes to your diet or starting supplements. In conclusion, and to summarize today's video, wrapping up, potassium is a crucial mineral that plays a key role in your overall health. Low potassium levels can have serious consequences for your heart, muscles, and other bodily functions. It's important to stay mindful of your potassium intake and adjust your diet accordingly. Thank you for tuning in to Levitas. If you found this video helpful and informative, be sure to share it with your friends and family. Give it a thumbs up, subscribe to our channel, and hit the bell icon to receive notifications for future videos on weight loss, health, and fitness content. Also, leave a comment sharing your questions, thoughts, and experiences with today's subject. We love hearing from you. Your support is very appreciated. It helps us grow and create even more content for empowering you to achieve a better body and optimal health every week. Remember to fuel your body with the right nutrients, stay consistent with your training, and keep striving for your fitness goals. Until next time, remain tuned to Levitas for more expert advice to help you on your health and fitness journey. So stay healthy, stay happy, and keep going.